Hi everyone, I'm Casey, and before we start I would just like to take the opportunity to thank the Herr lecture series for having me. Like they mentioned in my introduction, it's really a privilege to be able to speak about the things that I saw, so thank you so much for being here with me tonight. So I guess we'll get into the presentation. For the purposes of the presentation, when I refer to Doctors Without Borders, I'll likely refer to them by their more well-known acronym of MSF, or Médecins Sans Frontières. And if at all during the presentation you need clarification, or you want me to pause, or you can't hear me, do just stop me and let me know, okay? We'll have a period for questions at the end, but you're also welcome to ask during the presentation if you'd like. So a bit about my background is that I'm a registered nurse. I live in Saskatchewan. I'm from Saskatoon. And I've been a nurse for about 5 years. My experience is primarily in the emergency department, in the pediatric emergency department and the adult emergency department. That's where I work when I'm at home. And for the last 3.5 years, since early 2022, I've worked with MSF. And in that time, I've done 4 missions. The first to South Sudan, the second to the Democratic Republic of Congo, and the last 2 missions in Gaza, as was described in my introduction. So a bit about MSF for those who don't know. MSF is a primarily medical NGO that provides support to vulnerable populations, provides medical care, as well as other ancillary services to patients in like conflict, crisis, disaster, or exclusion or neglect. On the next slide, it talks a bit about our principles. And the 3 main principles that guide MSF are the principles of independence, neutrality, and impartiality. And so the principle of independence essentially means that all of our funding comes from donors. And none of our funding comes from governmental bodies. And so unlike other organizations like the UN or other NGOs, MSF only goes where MSF feels is necessary. And it's never governed by the whims of other political parties or governments. And so if there is a need, MSF can go because of donors. Neutrality and impartiality are really the principles that allow us to work in conflict and crisis situations so well. Often in conflict, if NGOs are seen as being associated with either side, whether by financial support or preferential bias, those NGOs won't be allowed to work. So MSF remains neutral and impartial so that we can provide the most medical care we can to the most people, typically on both sides of conflict. And that being said, another important part of MSF's values and beliefs is the principle of bearing witness, or témoignage in French, which means that although MSF does remain neutral and impartial and will provide medical care to anyone that is willing to lay down their arms and remove their uniform at the door of the hospital, MSF does not remain silent. Unlike some other organizations, one of the principles of MSF is to speak out. And so that's part of the reason why I'm here today. A bit of context about MSF in Gaza is that MSF has been in Gaza for many years, much before this most recent conflict. As you may or may not know, Gaza has been under siege in varying degrees for the last many, many years, honestly, since its infancy as a country and or as part of Palestine. And so MSF has been there in and out all along, helping to provide medical care and support the Palestinian Ministry of Health that works there. And so on October 7th, when the current conflict war broke out, the regular project team that was there before in the quote-unquote peacetime of Gaza had to exit, and the priorities of MSF changed, and they brought in what's called an emergency response team. And so in MSF, there are two types of projects: a regular project, which means it's lasting a while, or the conflict is protracted, like several years long, and emergency projects, which are in the acute, violent, and very volatile phase. So on October 7th, after October 7th, the priorities of the project switched and it became an emergency. So this is the UN OCHA map of the Strip when I was there. And as you'll see, it's quite complex, but basically the Strip is divided into 5 sections. In the south, you'll notice Rafah, which was a red zone all throughout the time I was there. Just above Rafah, you'll notice Khan Younis, which is where Nasser Medical Complex is, where I worked, where many of our health centers and clinics are, and where we lived in Khan Younis. Above Khan Younis is Deir al-Balah. MSF has other clinics in Deir al-Balah, run by each of its sections. There are 5 sections of MSF, and so you typically work for one section at a time. But MSF has other clinics in Deir al-Balah. In the northern part, you have Gaza City, which you can see on the map there. So there's the region of Gaza City all across, and then in the very northern part of the Strip, you have Gaza North. And so in the initial phase of the conflict, and when I was there on my first mission, all the people from Gaza North region and Gaza City, which was a great majority of the population actually, were displaced south to Deir al-Balah, Khan Younis, and initially Rafah. And Gaza City and Gaza North began to be obliterated in the war. And so all the people, about 2 million people that lived in Gaza at the time, were displaced and crunched into the bottom half of the Strip. That means living in tents and temporary structures and really, really high population density, which is not great for public health and spread of diseases, as you can imagine. On the bottom left-hand corner for you here, near to Egypt, there's a blue dot that says Karem Shalom, and that's the entrance into Gaza. Every person, every IV, every scrap of food that enters Gaza comes through Karem Shalom, and everything is checked there. It's a massive military checkpoint with high military walls and watchtowers and lots of weaponry. And all of the aid trucks that are slated to enter Gaza have to come through there, as well as all of the people. So when I entered, I passed from Amman, Jordan, is where I flew into, and I entered in a military convoy through Israel to Karem Shalom. And then at Karem Shalom, everything is searched, and you lose some things, they check some documents, you wait, and then you can enter the Strip in an armored vehicle convoy. It has to be an armored vehicle convoy because shortly after all the people were displaced from the north to the south of the Strip, Rafah was also evacuated. So all those people that lived in Rafah were pushed further up into only Khan Younis and Deir al-Balah. Those were the only inhabitable zones for much of the last 2 years. And Rafah became a red zone, which it still is today. Some notes about the context as I experienced it. Something that I didn't know upon entering Gaza was that Hamas was actually the elected government. The Gazan people chose Hamas in their last democratic election. And although the feeling now it was mixed, like many of my colleagues voted for Hamas, and at the time they chose them as their government. That was something I didn't know before entering. At the time that I was there, during the war, there was no governing force, there was no police presence, no law enforcement in Gaza. Hamas are not uniformed individuals. They haven't been in the conflict. And so this makes the conflict very complicated and difficult because there is no front line, there is no identification of Hamas versus civilians. It's very hard to distinguish, and so that puts civilians at a huge risk, unfortunately, in the conflict. We'll talk sometimes about the Israeli Defense Forces, or the IDF, which are the military forces in Israel that were controlling the borders of the Strip and all of the warfare that was going on. The IDF would, in my first mission, the IDF would issue evacuation orders for sections of the Strip that they identified. In an attempt to follow humanitarian law, they would attempt to clear the people from their area before they issued a ground invasion. And by ground invasion, I mean tanks and soldiers on foot. Mostly tanks. I actually never saw a soldier on foot. But the idea of the ground invasion was to destroy the infrastructure so that the people would have nowhere to go back to, and so that the Hamas would have nowhere to go back to. So although there was mostly aerial warfare all the time and at random without evacuation orders, the ground invasions would have evacuation orders issued, and those people in those blocks would be displaced. Sometimes the evacuation order came 24 hours before, sometimes 12, sometimes 1, sometimes 10 minutes. Sometimes it came with a phone call, by word of mouth, or by pamphlets dropped in the street. These were all things I saw during my time there. Like I mentioned, the warfare was mostly aerial, so the drones were always flying overhead, either doing surveillance or carrying out airstrikes. There was also a lot of helicopter and F-16 jet warfare for bigger missiles, for larger strikes. And there were, of course, the warships on the Mediterranean Sea that were visible from the beach that had long-range guns to shoot from the beach, and also often housed helicopters, so the helicopters could come in from the ships from the sea. Like I mentioned, all the supply was forced to come through Kerem Shalom, and that makes things extremely challenging because as the supply has to come through Kerem Shalom, it enters through Rafah. It has to pass through a red zone. And so in scarcity, there is always an increase in petty crime, and so often the supply trucks would be looted as they pass through Rafah up into the medical establishments. In the north of Gaza, sure.
Could you just tell us what a red zone is?
Oh, sure. A red zone means that it's been evacuated, it's not safe to go, there is an active military presence, so not safe for civilians to stay. Thank you for the question. In the north of Gaza, there were and are huge humanitarian needs. The second time that I was in Gaza, after the ceasefire broke, the population that was forced in, after the ceasefire was signed, and it was peacetime for a few weeks, much of the population that was evacuated to the south wanted to attempt to go back to the north to see what was left of their homes, of their businesses, of their families, find the bodies of their loved ones, things like this. So there was mass movement from the south to the north, and that proved a difficult humanitarian situation because all of the infrastructure in the north had been destroyed. And so that meant that all of the organizations, including us, had to double our infrastructure in the north and quickly. In the first mission that I was in Gaza, all of our movements were notified to what's called COGAT, which stands for the Coordination of Government Activities in the Territories meaning the occupied Palestinian territories. And so this is an Israeli paramilitary government body that MSF would notify, saying, this MSF car is moving from this point to this point at this time with these people and these supplies. And our vehicles were always identified on the roof so that the drones would know that it was us, and on the sides so that any tanks would know that it was MSF. Although identified vehicles have been and continue to be targeted, unfortunately. A little bit about where I worked was Nasser Medical Complex. And so it's a medical complex that consists of 3 hospitals, one maternal and pediatric, another general adult, and another surgical adult, and burns and orthopedics unit. And so I worked in the maternal and pediatrics building. And at Nasser, it was at one time invaded by the IDF. It was evacuated, although it was a health structure, a functioning health structure. It was evacuated and invaded. And when I worked there, there was still Hebrew graffiti on the walls that the patients had to look at that couldn't be cleaned. And parts of the hospital were still destroyed and under construction from that invasion. But as soon as the military forces moved out, like within days, the Palestinian Ministry of Health and MSF were back in the hospital, readying it to accept patients. So the team there is very experienced, and they were ready to make the hospital functional very quickly. Since the ceasefire has broken, unfortunately, Nasser Medical Complex has been targeted several times with patients in beds at the time of the strike, something that's a clear violation of humanitarian law. So a bit about MSF's activities in general. I worked for the Spanish section of MSF, so that is OCBA, we call it. And our activities involved my work at Nasser. We also had, at one time 3 and then at one time 2 medical clinics for primary care. And in the primary care clinics, we would do outpatient malnutrition, gynecological consultations, prenatal, postnatal care, mental health counseling, and sick clinic visits like your cough, cold, minor illness, as well as a small ER. We also, the logisticians of the project, I mentioned before providing ancillary services, and some of those involve what's called water trucking. In Gaza, all of the water supply has to be filtered through reverse osmosis because it all comes from the sea, from the Mediterranean. So it's all salty, so it's all filtered. And there are several RO plants throughout the strip, but the main one is large, and it's in Deir al-Balah, in the middle of the strip. And the power for that reverse osmosis plant, unfortunately, comes from Israel. And so at times they would cut the power to the plant, and that would make potable water very scarce. And so part of MSF's activities were to buy at an extreme premium and truck water to different points along the strip to make water more accessible, potable water more accessible to the people. This is a photo from where I lived, which was very close to the sea. And you can see kind of along the sea at sunset, close to the beach, there's lots of tents. You might be able to see there's a lot of temporary structures, all made with plastic sheeting, sheets of iron, sticks, blankets. That's where many of my colleagues, Palestinian colleagues, lived. And almost all of the patients lived in one of these temporary structures. People also did live in half-destroyed buildings at a great risk to themselves, but for some people that was preferable to living in a temporary structure. So a bit about what we did in the maternal and pediatric hospital where I worked specifically. We had pediatric emergency room and maternal emergency room. We had pediatric inpatient care, including neonatal intensive care and pediatric intensive care, as well as a maternal OR for C-sections and hysterectomies and things like that, and some mental health services as well. MSF specialty that we were really assisting the Palestinian Ministry of Health with, because actually the Palestinian Ministry of Health is quite robust in peacetime, and they have a really solid educational system and many experts actually. During wartime, though, unfortunately, there's not the infrastructure for those experts to operate, and as well during wartime, there was a lot more malnutrition. And so MSF, fortunately or unfortunately, is a bit of an expert in malnutrition care all around the world. And so we taught the local staff, nurses and doctors, about caring for malnourished children and how that was specific. So we ran the malnutrition ward there, the inpatient and the outpatient. So my role specifically was as the nursing activity manager, it's called. So essentially I coordinated with mostly Palestinian staff and some other international staff, as well as with the Palestinian Ministry of Health, to ensure that the hospitals and the clinics where MSF worked had supply of pharmaceuticals and equipment as best we could, was following standards of care the best we could in conflict time, and making sure everyone was staffed and safe and things like that as more of a manager. I worked every day in the hospital and worked quite often with patients as well, and just to really help understand what would work and what wouldn't. As you can imagine, there were many, many challenges being in Gaza, and a big one was supply. As I mentioned, everything came through Kerem Shalom, and often our trucks, although the manifest would have been pre-validated by Kogat, the Israeli authority, as I mentioned, they would often sit at Kerem Shalom for days, weeks, months. I had trucks arrive at Kerem Shalom the same time I was coming in that never made it in during my missions there. They would sit at the checkpoint being packed and repacked, damaged, sitting in the sun, in the heat and the rain. And you never knew what was going to come in, how much, in what condition, unfortunately. So that made providing care and following standards of care for people really challenging, and it meant that we had to do some triage, especially after the ceasefire broke and the borders were completely closed and nothing was coming in. We had to triage a lot of what we used, especially in mass casualty incidents. So supply was very difficult. Yeah. Another big challenge was infection prevention and control. And because of the supply issues, hand soap and alcohol-based hand rub and other cleaning materials that are basic fare for a hospital are necessary, and honestly necessary to avoid providing more harm when you do care, and instilling infection in people was, they're very difficult to come by, and we never knew how much we would have. And so trying to ration infection prevention supplies in a hospital with an operating theater was very difficult. And in a hospital with a neonatal intensive care unit is very difficult because neonates are immunocompromised when they're born. And so it was extremely challenging to do with what we had and to do our best. But unfortunately it meant there was a high rate of hospital-acquired infection in the hospital, and it was very tough to bring that down. Patient referrals were also a huge challenge, and so because the infrastructure in Gaza had all been destroyed, the patients that previously could have been treated by specialists living in Gaza the specialists were either no longer there or the infrastructure was no longer there. And so that meant those patients had to go out of the strip for care. And so WHO, the World Health Organization, was coordinating the referrals of the patients out of the strip, but this was extremely difficult, and there was a lot of red tape. These patients often needed urgent or emergent care and could not be referred in time. When I arrived for my first mission, the referral list, I remember being told it was thousands of patients long. And this was after I had just seen a baby in the NICU that had a very complex congenital heart condition that needed a specialized surgeon and specialized infrastructure and operating theater. And unfortunately, we cared for this baby and she suffered and died in Gaza because she couldn't go out for the care she needed. And this was one of literally thousands of patients on the list. This happened quite often. And of course, last but not least, certainly, were all of the human rights violations that we had to deal with daily for my Palestinian co-workers who I worked with very closely. Lack of access to food. Like I said, every scrap of food that enters Gaza has to come through Kerem Shalom and has to be validated. And so, especially in the spring, after the ceasefire was broken, they completely closed the borders and no food was coming in. And so people had to rely on their stores. People had to compete with their neighbors, their grandparents, their nieces and nephews to get themselves and their immediate family fed. And that was really tough to see in a very small geographical country where many of the families are closely intertwined and community is so important. It's tough to see those connections deteriorating because of lack of access and violations of humanitarian law. The lack of access to water, as I discussed, was also hugely problematic. This increases the illnesses, obviously, that come to the hospital, especially for children, pregnant and lactating women, and the elderly, the most vulnerable. And so the lack of access to all of these things just overwhelm the health structures even more. And when you already don't have supply, it just almost feels like you're drowning. But you just do your best. As well as the lack of evacuation orders, or the basically a lack of evacuation order. Sometimes it would come 5 minutes before, and people were scrambling at work to go and check on their families or try to move the things that they did have, or some of them at the end had just given up and said, like, I'm not moving, I noticed that was a big difference between my first and second missions. On my first mission, almost everyone would leave the hospital and say, I'm so sorry, like I need to go and move my things and check on my family. But on my second mission, many of the nurses just said, like, I've moved 8 times already, like I can't move again. There's nowhere for me to go. Especially when the ceasefire broke, when I was there in the spring. So as many of you may have heard in the news, there was a ceasefire for a few weeks in Gaza where there were much fewer strikes. And then as the negotiation talks started to deteriorate, without any warning, honestly, none of us expected it, the Palestinians or the NGOs or international staff. One night while we slept at 2 a.m, the strip just was carpeted with bombs and nowhere was safe. And while everyone slept, they killed hundreds of people that night, and all of our hospitals and clinics had mass casualty incidents. And after that, our priorities totally shifted, our care totally shifted, everyone's morale totally shifted. Everyone had lost someone, everyone knew someone that had died that night, and so that really changed the project after the ceasefire broke like that without warning. And of course, there were a lot of challenges, but there were also so many incredible, beautiful moments. And the people, the Palestinian staff, really were what made all of those challenges bearable. They honestly never complained. They never had a bad word to say. Honestly, I think I complained about the Israeli forces much more than they did. I never heard them say a bad word. And they were always coming to work, always wanting to work harder, like always asking for more to do. They wanted to contribute to their community, and all of that was so inspiring. I honestly wouldn't be the person that I am today without having met them. They're incredible. And on the left, we have your left. We have myself with one of our pediatricians. Her name is Dr. Wafa, and she's incredible. She's a machine. She worked 6 days a week at the hospital, every single day, managed our malnutrition ward, like learned the care of a malnourished patient like that, even though she had never done before. And several members of her family had been killed in the war, and she was still living very close to the hospital, so she could always get there. No matter what the situation was, she wanted to live close so that she could always be able to get there for her patients. So she was really incredible and is one of my role models today. In the center is myself with 2 of our nurses. One is Bilal, he was our infection prevention nurse, and the one in the back is Mohammed, and he was sort of my Palestinian right hand while I was there. We worked very closely together, and I learned so much from them. They always were joking and having a positive attitude, and speaking about the things that happen now honestly feels much heavier than what it felt like when I was there, because I was with them. And on the right is a drawing that has been done by one of the mental health patients in one of our clinics and was gifted to me. And it really represents, I think, the strength of the Palestinian people, what I saw and lived with every day. And actually that drawing hangs in our home now. Yeah. Lastly, I'd like to talk about a few stories, if that's okay with everyone, now that we've discussed the context a little bit. The first story I'd like to tell is about a patient, a young boy. He was around 7, with a condition called protein C deficiency. And protein C deficiency, as I would learn, is quite complex. And involves the whole body. It affects many systems. But one of the manifestations for this child was that he had very complex wounds. His skin would slough off as if it was burned. And so his dressings were very complex. He was at a high risk for infection, and he needed skin grafts. Not only did we not have the infrastructure or the specialized service to perform a skin graft, but we did have like a general surgeon that might have been willing to try to do this specialized work of a plastic surgeon, but unfortunately one of the complications of protein C deficiency is that they have a bleeding disorder of sorts as well. And so we didn't have the medicine to make it safe for him to go to the operating room without bleeding out, and so he couldn't be operated. He had to go out of the strip, and he was put on the referral list and was waiting on the referral list while I was there. And he came into the hospital often for infection because he lived in a tent on the sand with his open wounds. So he would often have dressing care, and he was very difficult to deal with. Our mental health team was also seeing him because he had gone almost mute from the pain of having to have his dressings changed all the time and from living like nearly without skin. And it felt like there was almost no hope for him. Like we had done everything we could and we were doing our best with his dressings, but he had to go out, and we had no control over that. It felt like all the red tape was for no reason. And another thing about the patient referrals that was extremely challenging was that anyone that could be referred out that was lucky enough to go outside of the strip for care, they and their families could not return to Gaza. They would not be let back in during the conflict, certainly. So if a mother had to leave with one of her children, that would mean leaving her husband and the rest of her children behind and potentially never seeing them again, being separated forever. One of our MSF staff, one of our watchmen, our guards at the guest house, his son was referred out of the strip for cancer care. Unfortunately, by the time his referral, he was diagnosed in the crisis time, and by the time his referral was completed, he left to Poland, I believe, with his mother and his sibling, and he died shortly after arriving in Poland. But our staff, his father, could not leave to see him. He couldn't leave to see his son buried, and he might never see them again, his family. He's stuck inside the strip and they're stuck outside. So families were also obviously a bit hesitant to go for the care that they needed for fear of separation. Another story was about Bilal, actually, the one that was in the picture in the green shirt with me. He was displaced almost the whole time of my first mission, almost the whole 6 weeks. He was between structures, between tents. People were always moving around, and so if someone moved back to a structure that they had previously vacated, it was then still theirs. And so anyways, Bilal was evacuated from his block and couldn't find a place to stay. And he was trying to avoid setting up a tent because he was with his elderly father, and he didn't want his elderly father to have to live in a tent. So he was trying to find one of the half-destroyed structures, which was preferable for them. But he searched for weeks, and all the while, like, working the whole time. Even though I insisted he take time off, he never would. He worked the whole time, and in the end of my mission, he didn't find a structure to stay in. He ended up living in a tent with his dad, but he had a positive attitude the whole time. I don't know how. One of the last tougher stories I'd like to tell was about the night the ceasefire broke, and in the weeks following, the airstrikes were completely random. None of the movements were notified. The Kogat, the Israeli authority, would not guarantee our safety in any movement. So anytime we wanted to provide care or move supplies or provide water, do any kind of movement, our safety was not guaranteed. And so it was completely random. Everyone was taking a risk no matter what you were out doing. And on the night the ceasefire broke, and in the following weeks, we had several mass casualty incidents at our clinics and our hospitals. And in debriefing these instances with the team, we were discussing the mass casualty triage system, which, if anyone knows about in medicine, is like there are green patients, and green patients are walking wounded. So they are stable, they can walk, so they walk away. Yellow patients can't walk, they need hospital level care, but they can wait a little bit. They're not imminently dying. There are red patients, and red patients need immediate intervention or else they will die, but their injuries are survivable. And black cases are ones who have injuries that are not survivable or who are already dead. And in our MCIs, we would have like 20 walking wounded, like 20 green, and 5 yellow, and 3 red, for example. And in one MCI, I remember we had 2 black cases. This was the night the ceasefire broke. And I remember discussing with the team about like why they had worked on these black cases when they know that the black cases are to be left aside and you're supposed to work and put the resources to the red cases. But they told me that the black cases were, one was a woman that was visibly pregnant, about 30 weeks pregnant, and another was a toddler. And so it was very difficult, and it is very difficult to make those decisions in the moment. Like, how do you decide for those 2 people not to provide any resources, even if it means like that potentially one of the red cases might die because you're using supplies on the black cases? Those kind of situations are impossible to decide. And ultimately in the debrief, we just decided that in the moment, you do what you have to do, whatever that means for you, whatever is best for you, for the community, for the patients that you're facing right there. Literature be damned, because in a situation like that, there's no right or wrong. I'd like to end with some more positive stories, and those were some of the happier moments. I think that sharing food with people is a really great way to connect, and Palestinian people especially, if anyone's ever been to the Middle East, but Palestinian people especially are extremely hospitable and are always trying to feed you. And sharing food is a huge way of building community. And so when we were working in the hospital, if there was a quiet moment in the morning, then one of the nurses would come and get me, or look at me from across the emergency department, and if I wasn't doing anything, would give me a signal, and we would all go to our little supply closet, and everyone would bring a little piece of something for a breakfast potluck. And we would have like pita bread and cheese and za'atar. This was during the ceasefire when there were things available. And we would share a little breakfast in the hospital, take a little break together, chat about the night before, about their trip around the strip to get to the hospital, and just get to know them. I was such a great way to get to know the staff, and I was so lucky that they included me in it. And another really positive story that I remember was actually the second time I was there during the ceasefire, and after the ceasefire broke, it was Ramadan, and unfortunately the Gaza had to celebrate Eid after the ceasefire had broken, and when everything was extremely unstable and people were dying en masse. But we had a few watchmen that lived close by to where we lived, and so when it was unsafe to move, they were close by and could still, come and help us out and fix things if we needed fixing, or help us with getting food from the market if we needed. And so they would come and be there, and we celebrated Eid with some of the watchmen, and they brought all these little containers of food that their wives had made in their tents on their cooking outdoor fires. And they kept saying, "I'm so sorry, it's so much better in peacetime. It tastes so much better in peacetime. We don't have the ingredients." And it was, I think, the best food I ate in all of my time there. It was incredible just to be able to share that special holiday with them. I felt so honored. So that was a really nice moment as well. Those are my stories. We can absolutely take questions and discussion, but I'd like, if you can flip to the next slide, if anyone would like, I'll leave this up here. You can scan the QR code, and it's MSF's petition for healthcare is not a target. Anyway, thank you.
Questions?
Thank you for what you've done.
A mic is coming.
Thank you for what you've done over there. I appreciate it, and I'm not anti-Semitic, but my voice was stolen. It was not okay for this to happen, and we were allowed to talk about it because the second you spoke out, were anti-Jew, we're anti-Israel. This is about human beings. Doctors and nurses who talked about this in front of governments all over the world made it okay to be not okay with this and to give us a voice. And for that, I personally thank you, because I now am allowed to say this is not okay. And I hope that you can speak to this. The beast from the east, Mohammed, whatever his last name is talking about malnutrition. And the flotilla, the Smooth flotilla, is getting closer to Gaza as we speak. And he is saying that it's not enough to give food because of the malnutrition. After you start eating when you've starved, it can actually be a detriment. So I'm hoping that you can speak a little bit about that.
Oh, sure. Clinical malnutrition, thank you for the question. Clinical malnutrition is very complex, but yes, when you have clinical malnutrition, which is a set of criteria that not everyone has, even if they're hungry, but it often happens mostly to children under 5 and pregnant and lactating women. So in those populations, yes, there are certain criteria that require admission, and yes, you can't eat. So when we receive a baby in the hospital for malnutrition, they start only receiving a specialized formula, and they only receive certain amounts at certain times a day, and they gradually titrate up until they can tolerate that, and then they switch to the second formula, which is called F100, and then they start to tolerate F100, but for much of their care, they don't eat regular food. They only have the specialized formula that is like a prescription, it's a medicine. And so, yeah, they are at high risk for conditions like refeeding syndrome and like heart failure associated with malnutrition, many things like that. So it is complex, but if you have clinical malnutrition, no, as a child, you can't just start eating again. It's a slow titration. Thank you.
Thank you for putting life into context. It's amazing what you've done and what everyone in your organization has done. I was just on your website and saw that 13 of your colleagues have died in this conflict so far, and you've been back 2 times. And you're able to share the stories with so much empathy. Would you go back a 3rd time? And what do you do for your mental health while you're here and your colleagues are so far away continuing to do the important work that they're doing?
Yeah, thank you so much. Yes, certainly I would go back a 3rd time. I would go back a million times. They have treated me so well. It's been so special to get to know the Palestinian people. And so, yeah, absolutely, I would go back in a heartbeat. And it's very tough to be home. Honestly, speaking like this, being able to speak about it with a room of people actively listening and like wanting to care, that's really helpful, and that's honestly really therapeutic for my mental health. I want to be back every day, all the time. I think about it every single day, and I would love to be back there all the time, but for the sake of the project and for the sake of, keeping fresh perspectives and fresh energy in Gaza, I think it is good that we rotate. But yeah, it is extremely hard to be back home from any work with MSF, but especially something as intense as Gaza. But I do have an amazing talk therapist and counselor, so I see her a lot.
I'm just curious about the decision-making process that you went through to get to the decision that you had to make to go there. Even the legalities, the visas, all of that kind of thing. And you're not very old, so it's not as though you had 15 or 20 years of experience here first. And out of curiosity, I'd be curious about that.
Yeah, that's a great question. My parents have asked the same question, to be quite honest. And, but it's tough to describe because honestly, it wasn't a decision at all. I think that once I started with MSF, I realized that for me, this is what it means to be human and like a contributor to the world, is to be there and live with these people. Not everyone has that privilege, has that opportunity, is able to do things like that, but I am, and I see how much it means to them, and so honestly, it's not a decision at all. I don't mean this as like as a martyr or anything, but like if I were to die on a mission, like that would be a privilege. People better than me, smarter than me, more deserving than me die all the time, and I had to watch them die, and so I'm just happy to be there and get to share their story. So.
Hi, thank you for your talk. I just have like a question about the language. We didn't really talk about how you communicated with your colleagues and with the patients. Might be one question. And the second is, I had some experience in hospitals overseas, and in peacetime. And it's very family oriented, so the family stays with the patient and helps, right? So I just wonder how that would...
Yeah, thanks for the question. All of the MSF hired staff spoke at least a bit of English. And so we mostly communicated in English, but I learned quite a bit of Arabic, just like some small phrases, how to ask, like, what's wrong with your child? Do they have diarrhea? Do they have a cough? You know, things like that I learned. Yes, no, greetings. You learned to get by, and to be honest, just to make the patients comfortable. Because if you can say a few things like that, it's huge for trust. And so, of course, for like a full history and examination, if it's complex, I'm going to have a translator. We had medical interpreters there who spoke almost better English than me, to be honest. And so I would always have one by my side if I needed it. But to make that first step with them, I find makes a huge difference for trust and their ability to open up to me. And honestly, the staff love it too. When you can start your morning greeting in Arabic, it just lightens the mood. So I tried to learn as much as I can, but yeah, mostly we communicated in English, the staff and I. And the second part of your question about family orientation, it was really interesting actually. There is huge amounts of community everywhere, but something that I learned to appreciate about the Muslim faith was that a huge part of it is giving back. And so there were often just like people off of the street, families off of the street that were living in a tent themselves, but would, you know, scrounge up whatever they could, some diapers from the market or some little cookies, and like go throughout the hospital just passing them out. And I would say to my coworkers, like, which NGO is that from? They're not wearing a vest, or like they're not identified. And they were like, no, that's so-and-so from this tent, like by the hospital. And that would happen every day. And so there was really like a community mindset. But yes, the families were a big part of their care team. And in this culture and in many cultures that I've worked with overseas, it was the mothers mostly. And it was actually quite special being a woman in that space where it was a maternal and pediatric environment where it's mothers caring for their children and sisters caring for their sisters during childbirth. And especially in an Islamic country, it's really special, I found, to be a woman in that space where I can walk into a room and the women can be uncovered and they can stay uncovered and feel comfortable if I'm assessing them, if like both of my male nursing colleagues were male. And so often I would go in first and introduce myself to the women and make them comfortable and ask if it was okay if my male colleagues entered. And so I was really lucky to be a woman in that space. I appreciate it a lot. Thanks.
Any more?
Is there a way, in the back rows, we're trying to scan that code. We can't scan it. Is there another way to be able to?
Yeah, I'd say feel free to come up after when we're done. I'll leave it up. Yeah. Or you can visit the MSF website. I'm sure it is there. Sorry. Yeah?
You talked a lot about having someone that you can talk to as your back. And we know there's so much about generational trauma and PTSD for humans. So I realize this isn't the key thing that everyone is thinking about. We're getting through next steps and the next right step right now. But as we look to these humans, what do we have to anticipate as we look for their care and where they sit right now and where they'll sit in the future as they look to their own mental health and how they will process this event?
Yeah, great question. Actually, as you may or may not know, Gaza has had conflicts like this, sometimes not as severe, but also sometimes as brutal in the past. And so actually what MSF Spain's project was in Gaza before the October 7th, before the war restarted, MSF Spain's project was a mental health project specifically. And so in countries that are a bit more conservative, mental health is sometimes a bit neglected, and so that was a big part of MSF's mandate there was specialized mental health care for PTSD from previous wars, for, women in difficult situations, things like this. And so I suspect once we get back to peacetime, inshallah, hopefully we'll have more projects like that again.
One more?
I really appreciate your courage, your stories of hope. I'm a high school teacher here in Macomb, and I told my students I was going to come and ask this question, so I'm going to ask it. What can I tell my students as far as actions they can take to support your organization, to support the cause in tangible, peaceful ways? I know that's a difficult question, but I think you would have a healthy perspective on that. Besides going,
Of course.
we're not all going to go.
Yeah, certainly.
Yeah, thank you, and thank you so much again for reminding us what it means to be human.
Thank you so much for that. That's really, really kind. And I love that you're here. I think that's great, and that you and your students are talking about it. Honestly, that's what I would say for someone that's young, is just to keep talking about it. Have those conversations, even when it's tough, or even when you don't know. Like, ask someone that you respect, that you think might know, talk about it. Share people's stories. And honestly, for students, I would say take to social media, because I, at first, didn't think much about posting on social media. I kind of thought, this doesn't really do anything, this isn't part of it. But being in Gaza, when the Palestinian people there have power and have internet, they see on social media when the rest of the world is standing with them, and that means a lot to them. They said to me how much it means to them. So I think that's a really great way for students to participate, is to just like raise awareness on social media and in their families and communities. For people like you that maybe have some monetary means, I would say make a donation. Whatever you can helps. Like I said at the beginning, MSF is all run by donations. And any organization working in Palestine, whether it's a Palestinian-based organization, and like a bigger organization like ICRC or MSF, they're all great organizations to donate to. I'm not saying don't donate to the UN, but the UN is obviously funded by government, so they have a lot of money already. But MSF's budget is quite tight usually, so obviously I am partial. So honestly, any donation is helpful.
Thank you very much.
Thank you so much, everyone.